So we're going to talk about bow hunter, and as you know, bow hunters pull their bows like this, which means they have to have head rotation to align with the target and the bow. And when you rotate your head on C1, C2, the artery that can be affected is the vertebral artery. And so the vertebral artery is called that because it travels through the vertebral foramen, and as it's making way intracranially, there are different segments, V1, V2, V3, V4. And so when you rotate the neck, you might kink off the vertebral artery from the head rotation. And if someone has a dominant side, or the other side is atretic, or for whatever reason is stenotic, the head rotation causes the symptoms and the signs of vertebral basilar insufficiency. So when we have a vertebral basilar insufficiency that is triggered by head rotation, that is the symptom and sign we should be looking for bow hunter syndrome. So the vertebral basilar system becomes the posterior cerebral arteries, which supplies both occipital cortex, and so it comes to us as homonymous hemianopsia, or cortical visual impairment, bilateral vision loss, or diplopia from posterior fossa ischemia that is precipitated by head rotation, as in pulling a bow. We do dynamic ultrasound and imaging in the position that's provocative, and so we're trying to show the occlusion or the closure or the fibromuscular dysplasia or the dissection or whatever is happening in the head rotation, trying to show that both with standard imaging but also rotational dynamic imaging, and usually that means we have to have CT, CTA, and ultrasound. You should be thinking about the bow hunter when people have transient vision loss or transient diplopia precipitated by head rotation, as if pulling a bow.